I'm Carissa Price. I'm the Chief Marketing Officer of Intel GE Care Innovations, and your host for the evening, I guess, or the weekend. And very happy to see all of you who made it here for our second annual hackathon. We are working here with the Stanford Center for Longevity, which is a great organization here on the Stanford campus. It's really focused on aging and different solutions to aging in place healthy, safely, and securely. So I want to thank them for their partnership here. Care Innovations, and I'll just share a little bit. Don't worry, it's not going to be a long sales pitch. Why are we here? Why would we do this hackathon here at Stanford? So Care Innovations itself is focused on connecting the care continuum to the home. And the theme for this is, what is a care team? So why would we pick this theme? What you see here on the screen, just to sort of set the problem, right? This is what most people think of when they think of a care team. If I Google care team, these are the images I get, right? Happy physicians, clinicians in an acute environment. Everybody's happy. That's a care team if you look it up. But the reality is it more like this today? Right? So not so happy physicians, not so happy nurses, not so happy family caregivers, not so happy seniors. And I think despite all of the technologies that we hear about and all of these great apps and all of these great things, we still have a long ways to go in terms of really thinking about, how do we care for people? How do we care for people where they want to be, which is at home? There is a very often quoted and very true survey that 90% of people 65 plus, when polled, when asked where do they want to age, where do they want to be as they age, say at home. So how do we think about a care team in a world where we're trying to keep people at home where they want to be? How do we extend and connect that care continuum and in the process empower physicians, empower nurses, empower people that can have all this wonderful access to data, and you'll hear, and you all do, that's why you're here, right? Of all these wonderful applications and software and data and all these things we can do. But 92% of physicians and nurses, when polled, hate their EHR. Hate is a very strong word in my book, right? So I think that we can do better, and that's really the reason why we're here, is to say, look, let's bring together a set of collective minds and think about, how do we really want to define the care team for today and tomorrow? How do we really want to empower these care teams, whether it's yourself or someone that you know? We have Colin here with us today. He came last year, right? He is a family caregiver. He is an entrepreneur. He is a creative mind who thought, I live with this with my daughter every day. We can do better than this. And that's really the challenge I put in front of all of you today, is how do we come together to think of new solutions to this that empower the care teams of today and tomorrow? And how do we think broadly of what those care teams need to look like in order to truly affect change in the healthcare system, to truly empower the people that are on the front lines every single day, trying to provide care and health and wellness and comfort to people who need it. So that's really the theme of why that we're here today. I can't wait to see what you guys come up with over the ensuing time. Last year was it was my first hackathon ever. I had never done it before. And it was just amazing to see all the energy that you guys bring to this process, right? And that cross-pollination and that creativity that can happen when people put aside their boxes that they live in and put aside the mindsets that they live in every single day to think of something new and to listen to someone else and say, yes, and. How do we create something new and different? And so we're going to go through a little bit about structures. How many people here have been to a hackathon before? So great, we've got a lot of novices as well. We've got some people that are experienced. So we're here to create something new, both in terms of the experience itself, as well as the solutions that come on the other side. So I'll talk a little bit about it, just for those of you who might not have done this before. First, why is Care Innovations as a company sponsoring this? Just to give you full disclosure and context, obviously with parents like the names of Intel and GE, we are a technology company, but we're really focused on connecting the care continuum to the home. So we're very focused on aspects of what you all will be focused on this weekend. And that starts for us really here with patient and caregiver engagement. That was our theme last year. And that was sort of the call we put out into the marketplace, is help us think about, how do we engage people in their own health? How do we engage patients, people like ourselves, in their own health? How do we create better solutions for that? In our world, we have a platform, it's called Health Harmony, that actually does this today. So we have a whole data analytics piece of this. We're able to collect data from patients at home and family caregivers through smart sensors, through wearables, through a variety of different things, and then turn that into actionable insights for our clients who are on the clinical side. So most of our clients are either clinicians or payers, and they're looking to manage chronic conditions in new and innovative ways. So that's what we're about as a company. That's what we do every single day. But we by no means think that we have all the answers. No way for anyone to have all the answers. So that's why we sponsor these things, to say, how do we foster an ecosystem around us? Because we also are a device agnostic company. So we partner with a lot of people to put together those solutions for our clients. So we're hoping that one of you is going to be like Colin and have an idea that actually gets traction, and you go out there and you build that, and we can partner with you to bring that to the marketplace. So that's why we're here. That's why you're here. This is the Health Harmony platform, but it isn't about what we've already built. This weekend is about you. This weekend is about thinking outside the box, about what new and creative solutions can we bring to the care teams of today and tomorrow, and to really think about that from a person-centric perspective. How do we make that experience of that physician, of that nurse, of that professional caregiver, of that family caregiver, and that consumer? And that's my world. I came from the consumer marketing background. We have target segmentations of 25 different segments of how you eat breakfast cereal. Billions of dollars are spent trying to understand how to get you to eat more of a particular kind of breakfast cereal. So how do we bring that same kind of power of understanding people to healthcare? And think about the care team that way. How do you create something that anyone in that ecosystem is happy to use?